On this episode of Inside the Outcomes, my guests are two of the founding members of the Occupational Therapy and Disability Studies Network. The network's mission is to provide a community that creates and disseminates knowledge integrating contributions from disability studies into the field of occupational therapy. Dr. Danbi Lee is an associate professor in the Division of Occupational Therapy in the Department of Rehabilitation Medicine and a core faculty member of the Disability Studies program at the University of Washington, Seattle. Dr. Elisa Sheth is an assistant professor of occupational therapy at Pacific University in Hillsboro, Oregon. Welcome to the podcast, Dr. Lee and Dr. Sheth. Dr. Lee, can you tell us a little bit more about the Occupational Therapy and Disability Studies Network and why it was established?
Sure. So it's been 10 years already. Realize it's our 10th anniversary of our, establishing this network. But it was really six OTs who at the time were pursuing a PhD in disability studies at University of Illinois at Chicago, which was one of the first disability studies PhD program in the US. And, as part of the program, there were a lot of conversations happening that was about challenging how society views disability and reframing it. And, we saw a lot of gap and issues and concerns in our field, especially, as a field being that is part of the healthcare system. So historically, OT has been informed by the medical model, which really sees disability as a deficit and abnormality. And, disability is medicalized. And OTs have seen ourselves as those experts who know the best for the people with disabilities and, who can fix and rehabilitate them. So we are all really motivated and ready to shake things up in our field and challenge the status quo. And so there's one week we just let's, take some actions and we got together over a bottle of wine and we're still laughing about it because that speaks to who we are. But we decided the name of our group and threw around big ideas about what our vision and mission would be as a group. And really our vision is to, foster critically reflective and socially responsive profession. And we think the way we can promote that is by infusing disability studies perspectives throughout our field and education and practice and scholarship. And we really hope to promote this by, helping clinicians, educators, and researchers reframe how they see disability. So disability is not an individual problem, but that it is a social construct. The idea that people with disabilities are disabled by our society or the system or ableism, right? Like that is designed all for people without disabilities. And also seeing disability as part of a diversity and human variation and as an identity and not just as a deficit. Again, we know the way people see disability influences how they work. And in a field, that means that changes all aspects of education, research, and practice. And really, our goal is to help our profession to see disability in a different way and change ultimately the practice we're doing.
Dr. Sheth, can you talk a little bit more about the importance of including disability studies in occupational therapy?
Yeah, absolutely. This is a really great question, and I think a really important one. Donby was talking a little bit about what we as the, Disability Studies, OT and Disability Studies Network, we're seeing kind of in our own practice and our own experiences. And I think the question around integrating the two in curricula has been something we've looked at in a number of different research projects we've done as a group. One of our early projects was looking at disability simulations, which are actually a really common thing that's used in OT and other health professions curriculum. And those are sort of those activities where like students simulate what it's like to have a visual impairment by wearing like fogged up like Vaseline goggles, or they may simulate what it's like to have a mobility impairment by using a wheelchair for a day, like those sorts of activities. And so we really took a look at the literature and found that, particularly from, people in the disability studies world, were really had some significant and important critiques of these practices, and actually found that these sorts of activities don't have the learning outcomes that we think they may, and they actually perpetuate stereotypes and negative perceptions around disability. And so I think that's one just good example of how a disability studies lens can really help us as OT educators kind of better reflect, the self-identified needs and priorities of disabled people and disability communities. And as Dami also mentioned, right, be more critically reflective in our practices, right? We've also done some research where we talked with OT practitioners about disability studies and really saw that a lot of practitioners see the connections, right, around navigating systemic barriers, around all these things that really impact the people we work with that maybe traditional frames of reference of practice just don't address, right? But I think that we also found that there's often a lack of knowledge about disability studies, and that there really is some value in that educational exposure to disability studies, both like when students are going through their OT education program, but also afterwards and like continuing education or other sort of practice. So again, around like really helping people navigate those systemic barriers to improve, quality of life and outcomes. I think disability studies is a really valuable, framework, and has a lot of important ideas that we can, work with. One other, a couple other projects that we've been working on kind of around this is we were looked at, there was a special issue on disability studies in the American Journal of Occupational Therapy in 2005. And we were actually able to track down a lot of those researchers and authors. And we interviewed them a few years ago to kind of see their perspectives around, what value does disability studies have for occupational therapy. And, those authors really highlighted that disability studies helps us think about non-medicalized views of disability and the lived experience and community-based services. And that can be really valuable for an OT curriculum. And that there's been some really good movement sort of in that direction, but there's still a lot of work to be done in terms of really being more accessible and inclusive in our kind of OT education practices. I think that, linking this back to some of the ideas that Donby was talking about, that I think disability studies really helps us look at how our educational practices might be ableist or biased in other ways, and can really help provide a lot of good tools for students and practitioners to work with more collaboratively with disabled people and communities. I think more recently, we've also started looking at how we can use a disability studies lens to help create a more inclusive and accessible profession, meaning how can we support disabled OT students, and how can we support disabled OT practitioners to flourish in our profession and to really value the contributions of disabled students and practitioners and researchers to really push the field forward. And I think that speaks to our group as well. We are a group that some of our members identify as disabled and others identify as non-disabled. And so we're really trying to bring in, kind of those varied perspectives to really see again how we can promote a more inclusive profession, really, to put it simply. I think in my own kind of practice experience, I've worked for a number of years with people with intellectual and developmental disabilities, or IDD, from early childhood services through adult services. And I think I was lucky to be able to work on some research projects that looked at institutional care. So people who are in more skilled nursing facilities or larger institutions, or even like large group homes and some of those other places where particularly adults with disabilities often kind of end up. And I think it really made me consider the impact that those sorts of settings that can be very restrictive are often very medicalized in their focus and not very empowering or supporting of like self-advocacy. How then, now kind of in my career, both as an educator and someone who supervises students in the field, how can I help build partnerships with community-based services for folks with IDD that are more inclusive, that really want to support people to be a part of their communities and not kind of be in these more segregated settings, which unfortunately are still very common places where a lot of OTs work. So that really helped me, I think, shift how I was thinking about where OTs can be, right? And the types of supports that we can really help provide.
What is the typical occupational therapy curriculum?
OT curriculum is really regulated by a body called ACOTE, the Accrediting Council of Occupational Therapy Education. And there's very specific standards that every occupational therapy education program has to meet. And they run a wide gamut from, learning about different conditions and, functional skills through research skills, advocacy skills, that sort of thing. And actually, something that the OT and Disability Studies Network has done in the past, we've actually written letters to this accrediting body promoting some more explicit standards that specifically talk about disability, and really promote students learning more about disability in their OT curriculum. And we haven't been super successful, although I will say there has been some shift where I think the standards are talking more about like social determinants of health, some of those bigger kind of systemic factors. But I think to kind of go back to your question, Sharon, right? Yeah, I think practitioners see the connections between disability studies and OT, but a lot of education is still really focused on more of like an individual, someone has this diagnosis, or these sort of functional impairments, and it still can feel very medicalized in a lot of ways. And I think too, really kind of what some of the stuff Donby was talking about was that like we often bring in our own stereotypes and ideas about the goals that people should have, about the things that, like you were saying, right? OTs help people with things they want or need to do, but often we bring our own biases to what those things should be. Whereas often, maybe a disabled person might have a very different idea about what they want and need to do during the day versus what we think they should want or need to do during the day, or how they do it. That's another one. I think a good example would be like OTs sometimes can get very focused on independence and helping someone be independent. And that actually is not often a priority for a lot of disabled people. And the disabled community at large often really talks about interdependence. So this idea that we're all connected and then we all kind of help each other. And so it's not a priority to be able to do something on your own. More of the priority is, do you have the resources and are you able to connect to other people to help you get those things done? And I think that's a good example of sometimes the disconnect between more traditional OT education and disability studies.
Dombey, you were going to add something.
Yeah, just thinking about OT and how disability studies perspectives can inform. I mean, one thing that comes to my mind, a lot of OTs, really focus on the individual as a problem. So they try to, focus on functional improvement. And what we less talk about is the barriers that they will face when they go home, right? They're in a hospital setting. Of course, there should be a focus on the individual and the body, the body, like the improvement. Well, start over, but improving body function. But when they go home, they face a whole lot of societal, systemic barriers, attitudinal barriers, and we don't necessarily talk about that. And that's why it needs to be part of education. So it is part of our discussion, everyday discussion with our clients, and we prepare them because that's going to be part of their life, right? So I think that expansion of like looking at disability, not only on individual level, but also societal level.
I wanted to get back to the network and talk specifically about some of the products that you've worked on and are working on. Can you talk a little bit about that?
Yeah, absolutely. So in addition to some of those research projects that we've been, really fortunate to publish, we also, present pretty frequently at a number of different conferences. We've done workshops and posters with the American Occupational Therapy Association, the World Federation of Occupational Therapy, and then some state occupational therapy conferences. And we've also, done some work with the Society for Applied Anthropology, which does some interesting work around medical anthropology and bringing kind of disabilities and OT and other healthcare professions together. So that's been one way we've really tried to kind of get the work we're doing out there. As I mentioned, there was a special issue on disability studies in the American Journal of Occupational Therapy in 2005, and then we helped guest edit a kind of updated version of that in 2021. And so we really tried to bring different research from really all over the world around, disability studies, and it was a really great collection of research in different practice areas with different communities, some more like around education, other around more practice and that sort of thing. We've also worked on some book chapters. We have an upcoming chapter that will be in a text called Occupational Therapy Without Borders, which really tries to kind of challenge, traditional narratives in the profession. So it was really great to be able to be a part of that. Kind of outside the more traditional, academic publishing, we've also tried to have periodic like webinars or online conversations where we've brought in authors that we worked with in the special issue so that they were able to talk about their work in a little bit more of an accessible way, answer questions folks might have about their research. And we've also had some, discussions online where we bring folks together to talk about, disability related topics in the field and just kind of provide a avenue, right, for people to talk about ableism in OT, right, and get some insights into what other people are thinking about these sorts of topics. We also have some social media. We have a YouTube channel where we store a lot of the conversations and webinars that we've had, and a Facebook page where we're able to share, some of the other things that we've been working on. Donby's going to talk a little bit more about our new public-facing website, but that's been a really exciting project we've worked on for the last, almost a year and a half now. That was funded by the University of Washington Harlan Hahn Endowed Fund. So that's a really exciting development too that we're really looking forward to rolling out.
Zombie, can you talk a little bit more about the website and what people can find there?
Yeah, sure. So the website has been our dream for a while, and we finally got funding to make it work, make it happen. And so we had so many resources and knowledge that we gained over the years that we wanted to share and disseminate and make it easy to access, right, to a lot of people. And so one of the focus we had for the website, or a starting point, was to create modules for educators. We created these modules that educators could easily integrate into their teaching. And so far, we created 3 modules. There's one ethics case that gets at ethical clinical reasoning. We're using the Tim Bowers case, which was assisted suicide case with someone who acquired spinal cord injury. This case kind of gets at ableism and how ableism influences people's choice and our practice, and the importance also, it also highlights the importance of understanding lived experiences of people with disabilities and the importance of connecting with the disability community and really understanding what it means to have a disability and what, that life is worth living with a disability, and really combating that notion that disability is a bad thing that you should not be living. Another module focusing on medical and the social models of disabilities, which really gives a basic understanding of what those models are and how they can inform occupational therapy practice. And then lastly, there is a disability culture module. And so these modules really they're all structured in the same way. So we have a brief introduction, a presentation that is recorded that students can watch. And then we have guides for instructors that include like discussion questions, different ways to use the materials that we offer, a list of resources that they can use and integrate. So it provides a fairly comprehensive guide for instructors to use. We also have a page dedicated to resources, and some of the topics are, some of the categories of the resources include literature that are specific to OT, but informed by disability studies, disability rights and legislation, disability networks and advocacy, disability arts and culture. There's also a section where you can find disability narratives, because it's so important to listen to stories and lived experiences of people who have that experience, right? We are, as a non-disabled scholar, I'm, an outsider of their experience, and there's so much value in reading the stories and the narratives that people with lived experience provide. There's a section where we post all our events. We post all our publications there. And there's a practice section that is yet to be developed.
And what is the web address?
It's otdsnetwork.org.
Thank you both for being on the podcast. This has been very informative, and I'm looking forward to what's next.
Thank you.
Yeah, thanks for having us.
This has been Inside the Outcomes, a rehabilitation research podcast. This podcast is supported by the National Institute on Disability, Independent Living, and Rehabilitation Research. This is your host, Sharon Parmet, signing off.